Good afternoon, everybody. Assalamualaikum warahmatullahi wabarakatuh. This is Dino Djalal from Foreign Policy Community of Indonesia. Last year, when we had our big conference where Foreign Minister Retno Marsudi spoke, I think few of us predicted what would happen in 2020. We spoke about a lot of other things, but I think all of us were surprised at how today the world focus and attention and energy is really directed towards one big issue: how to beat COVID-19. This is happening all around the world, and it's the #1 preoccupation for Indonesia's foreign policy. I'm sure the minister would agree to that. Today, we will have a discussion on Indonesia's foreign policy to address the threat of COVID-19, and we have the best possible speaker for it, which is my good friend and Indonesia's distinguished foreign minister, Retno Marsudi, who is also has joined the new club of young grandmothers. Congratulations. What is Indonesia's foreign policy towards on the COVID-19 crisis? How does diplomacy serve the national interest to protect our people from the threat of COVID-19? How does Indonesia see the international dynamics where we expect to see more cooperation, but unfortunately see still a lot of competitive rivalries as well? And how does Indonesia see this COVID-19 crisis playing out internationally? I mean, these are the questions that will be addressed during the presentation and discussion by Foreign Minister Retno Marsudi. We will begin with the presentation by Foreign Minister Retno, and then after that we will take your questions in different batches. And I'm pleased to welcome a number of ambassadors in Indonesia, ambassadors assigned to Indonesia, who are joining the Zoom call and will have the opportunity to ask questions, and also students from all around Indonesia. Their faces are in the Zoom call, and also some think tanks. So without much ado, I will give the floor to Foreign Minister Retno Marsudi. The floor is yours, Minister.
Well, thank you very much. Thank you for having me, Dino and FPCI, for inviting me today to speak on the Indonesian foreign policy in addressing the threat of COVID-19. And I just want to say once again to ambassadors and other colleagues who participated in this webinar. For the ambassador, we missed the iftar. Usually I hosted the iftar every Ramadan, but we have to skip the iftar for this year. So we have to bear with the situation, and hopefully that next year everything will get back to normal again. So thank you very much for participating in this webinar. It seems that the webinar will become the new normal for all of us nowadays. Colleagues, ambassadors, ladies and gentlemen, we are in the midst of unprecedented time in history, where an infectious disease has profoundly changed the way we live. Physical distancing, wearing masks in public, frequent hand washing, working from home like most of us here, virtual meeting like what we are having right now. These are only a glimpse of our new reality. But how does this new reality affect our foreign policy? The interface between pandemic and foreign policy. So I would like to briefly speak on 3 key issues. One is on the magnitude of COVID-19 challenge. And then the second one is on the diplomacy in time of COVID-19. And then the third one is the observation on post-COVID-19 world. So let me start with the first issue, that is the magnitude of COVID-19 challenge. I just want to update you. The number of confirmed cases worldwide by by yesterday, it has exceeded 3.9 million, resulting in more than 270,000 deaths. So far, roughly 75% of the cases were reported in Europe and the US. WHO said an average of 80,000 new cases are reported every day since the beginning of April 2020. In Western Europe, the epidemics appear to be stable and declining, but the worst is far from over in other parts of the world. Increasing trends are evident in Africa, in Latin America, and in some Asian countries. In the meantime, the ripple effect of COVID-19 continues to spread. The IMF, for example, said it is anticipating the worst economic crisis since the Great Depression, with global growth expected to decline by 3%. The Asian Development Bank said that in Southeast Asia, growth could drop to 1%. Last Tuesday, the Indonesian Statistic Agency, BPS, announced that Indonesia economy grew 2.97% in the first quarter of 2020. It is the weakest since 2001, but if I compare with other countries, we can still see the positive growth in the Indonesian economy. But we shouldn't be surprised if the world growth will be worse in the second quarter this year. The ILO mentioned that almost 1.6 billion informal economy workers, or nearly half of the global workforce, have suffered massive damage to their capacity to earn a living. And then I would like to quote some part of the UN Secretary General's statement that he has warned that poverty could rise by 500 million people, the first increase in 3 decades. That is the statement of the UN Secretary General on the 30th April 2020. And then WFP said that the disruption on the economic order and measures taken to curb COVID-19 could send an additional 113 million people on the brink of starvation by the end of this year. Now, what do these numbers mean? Some have been saying that the COVID-19 is the great equalizer. To some extent, this is true. But if we see beyond that, COVID-19 also exposes the deep inequalities between countries and hit hardest, among others, to the poorest. As has always been the case, developing countries and the least developed countries are facing greater risk. COVID-19 is also creating question of the virtue of globalization and interconnectedness. Many countries resorted of protectionism from sealing their border, expelling foreign nationals, to limiting their medical equipment export. We, Asian people, are being stigmatized in many places as the ones bringing in the virus. Foreigners and returning citizens are also targeted. The vulnerable groups are among the hardest hit by this pandemic. At the same time, global political rivalry amplifies as great powers are playing the blaming game on the virus. As you can see, these developments are certainly not conducive. I would like to repeat it again. These developments are certainly not conducive at a time where global solidarity and collaboration are imperative. Ambassadors, colleagues, ladies and gentlemen, this brings me to the second issue, that is the Indonesian diplomacy in the time of COVID-19. COVID-19, of course, knows no border. No country is immune from it, no matter how powerful or prosperous. Everyone's hands are tied. We know all that. And this is what makes international cooperation a challenge right now. Indonesia firmly believes that no country is strong enough to tackle COVID-19 on its own. Only by synergizing our strength and keeping the international cooperation alive can we win this battle. Our time and energy must only be focused on what is important, that is, tackling the virus. These are crucial modalities to defeat COVID-19, and our engagement with other countries is always geared to promote these ideals. There is no better place to begin this call for solidarity than the United Nations. In the first week of April, along with 5 other countries, Ghana, Liechtenstein, Norway, Singapore, and Switzerland, Indonesia co-initiated a UN General Assembly resolution on global solidarity to fight against COVID-19. 188 countries sponsored the resolution. This is a testament of universality of support and importance of the problem. If you ask me if there has been any adjustment to the priorities of Indonesian diplomacy in this situation, the answer is yes. On top of the 4+1 priorities, which I believe you are already familiar with, our immediate priorities right now are first, addressing COVID-19 by ensuring availability and access to medical equipment and medicine as well as vaccine. The second is strengthening the protection of Indonesian citizens abroad. On the first priority, Indonesia must ensure that all countries have what it takes to defeat COVID-19. All countries we know encounter shortages of various medical supplies. We have no other option but to strengthen cooperation among countries in the provision of medical supplies. Experience from countries hit earlier has taught us that availability and the steady supply of medical supplies could make a difference in terms of lives we could save. So cooperation and supporting each other are must. Our diplomatic machinery must work creatively on bilateral level to fill these shortages, making full use of each country's comparative advantages, raw materials, technology, and labor resources. So on the bilateral level, we try to fill these shortages by trying to blend our comparative advantages with countries who pose raw materials, technologies, and labor resources. With Japan and ROK, for example, we have established joint production of medical equipments such as personal protective equipments, PPEs, as well as surgical gown. In the midst of disrupted global trade and supply chain, Indonesia urges all countries to facilitate smooth movement of essential goods like medical equipment and medicine, and refrain from imposing unnecessary trade barriers. Almost half of countries in the world are still imposing export restriction on essential medical goods. As for the international support, Indonesia is grateful to support provided to date by 9 countries, 10 international organizations and entities, and 82 non-governmental entities. The biggest support received includes masks, PPEs, and rapid test kits. In line with our commitment to solidarity, Indonesia also seeks to be at the providing end of international support. We sent some to Wuhan in early January, and now we are exploring the possibility of providing financial and in-kind assistance to countries in our neighboring region, the Pacific, including through the involvement of our state-owned enterprises. This is not time for us to be selfish. We need each other. We would welcome help to tackle shortages of medical supplies, but we are also ready to help others. And then on the multilateral front, Indonesia takes part in the WHO Solidarity Trial to find an effective treatment for COVID-19. We were the first country in the WHO's Southeast Asia region to begin the trial. 22 Indonesian hospitals participate in this endeavor. Now for vaccine. This is a very delicate issue, colleagues, ladies and gentlemen. There is no denying that innovation in vaccine development must be protected and rewarded. But once vaccine is found, it must be accessible and affordable in timely manner to all countries, particularly least developed and developing countries. Vaccine will be a game changer to this pandemic. I would like to repeat that vaccine will be a game changer to this pandemic. This was one of the main messages that my president conveyed in the Non-Aligned Movement Summit last Monday. I have also personally communicated this message, including in the ASEAN-US Ministerial Meeting and COVID-19 International Coordination Group meeting. Indeed, we must ensure that the system benefit for all of us, not only benefit to certain groups. The pandemic has taught us a lesson. Global health system and governance must be able to facilitate equitable access to quality and cost-effective medical products, vaccines, and technology. The second priority of the Indonesian diplomacy right now is strengthening the protection of Indonesian citizens abroad. This includes facilitating their repatriation and supporting their well-being. Such protection becomes more important in the crisis situation like this. Many are stranded and affected due to the lockdown imposed by many countries. So let me talk first about repatriation. From Malaysia, as of yesterday, 71,659 Indonesians have returned home. The government also supports the well-being of Indonesians in Malaysia who are badly affected by the Movement Control Order or MCO. As of yesterday, 315,168 packages of basic needs have been distributed to Indonesians in Malaysia. That is not a small amount. It's more than 300,000 packages have been distributed to Indonesians in Malaysia. As for Indonesia cruise vessel cruises, sounds like the same. So Indonesian cruise, 13,542 have been returned home. And then on top of that, 3,243 Indonesians are returning home from 23 countries. For sure, colleagues, especially you, the ambassador, we all know that repatriation is not an easy undertaking. There are health protocols that must be observed prior to their departure and after their arrival. This is very important to prevent the spread of COVID-19 within Indonesia. We strive to ensure those who are repatriated can safely return to their intended destination in Indonesia. Now, I would like to share with you the number of Indonesians living abroad who are infected with COVID-19. As of yesterday, there have been 723 confirmed cases. 347 remains under treatment, 338 have recovered, and 38 have unfortunately passed away. We consistently monitor their situation and ensure they receive necessary health service in line with the host country's regulation. Foreigners living in Indonesia is also part of the ministry responsibility as well. And we have so far facilitated the repatriation over 7,000 foreigners to their home countries. Most of them are travelers, families of experts, diplomatic corps, and the process, of course, are carried out in accordance with the national health protocol in line with WHO standard. Ambassadors, colleagues, ladies and gentlemen, these are only few examples of Indonesia diplomacy to address immediate needs arising from COVID-19. In the meantime, we continue to support both national and global efforts to mitigate ripple effect of COVID-19. The G20 Extraordinary Leaders Summit last March resulted in a commitment to inject $5 trillion into the global economy to cushion the impact of COVID-19. The ASEAN and ASEAN Plus 3 Summit last month identified proposal to establish ASEAN COVID-19 Response Fund, ASEAN Plus 3 Task Force on Pandemic, and ASEAN Plus 3 Reserve of Essential Medical Supplies. Moreover, the Non-Aligned Movement Summit this week decided to establish a task force to develop a database of medical and humanitarian needs of named countries. Colleagues, ladies and gentlemen, now it comes to my third point and my final issue, that is the post-COVID-19 world. The responsibility now is on us to reflect and build on our experience with COVID-19, because COVID-19 might not be the last pandemic in our time. First and foremost, we need to strengthen our pandemic preparedness strategy and our capacity to act early against any future pandemic. At national level, this would mean investing in resilient, self-reliance, and affordable health system. The number and capacity of medical workers and intensive care unit must be able to match any pandemic threat. This also means strengthening the capacity of relevant domestic industries, particularly the health industries. So building of inventory buffer could be considered to anticipate surging medical needs in the future. More investment on research and development of medicine, vaccine, and medical equipment is also important. We need to accelerate know-how transfer from developed countries to developing and least developed countries. It also means that we need to provide positive environment for foreign investment on health industries. On the global level, we must strengthen global health governance, the WHO, to better prevent and respond to pandemic. Developing countries must have a say in this. Ensuring patent regime flexibilities to benefit developing and least developed countries is also very important. It must trigger innovation, but don't forget, colleague, at the same time, it should serve its social function. On economic sphere, countries will need to diversify their economies to avoid over-dependence on commodity export. We should leverage more the use of technologies and digital economy. Countries may need to strengthen a long-term supply chain resilience. There will be a shift in how globalization is perceived, especially if we look at the growing number and effectiveness of regionalism. So I assume that no more globalization at all costs. Regionalism will continue to rise as the building block for globalization. COVID-19 is an important test for globalization, and it will be a defining moment for its relevance in the future. Therefore, cooperation under ASEAN and ASEAN Plus 3 will remain the anchor of Indonesian foreign policy. And Indonesia will continue to promote for sure the spirit of cooperation and multilateralism. So Ambassador, colleagues, ladies and gentlemen, to conclude, this pandemic is far from over. Many of us are anxious and asking, when will things get back to normal? I don't have an answer for this. Life might not be the same after COVID-19. There are so many unknowns and uncertainties right now. Few things are certain, however. International cooperation and solidarity are keys to addressing COVID-19. And our diplomacy will contribute to these ideals. On top of that, of course, multilateralism remains also very important. So that's all from me right now. And thank you very much. And of course, stay healthy, stay strong, and stay united. Thank you, Dino.
Thank you very much, Foreign Minister, for that very clear, comprehensive, and forward-looking presentation. And we have a clear picture on how Indonesian foreign policy looks at the challenge of COVID-19. In the interest of time, I'm going to forego my own questions and be unselfish and go straight to the discussion period. We're going to divide it in several stages. The first 4 questions I will give to ambassadors, and after that, the Foreign Minister will answer, and then we move on to the next batch of questions. The ones that I have on my list, on the first 4, are the Ambassador of China, Ambassador Xiao Qian, Ambassador of South Korea, Changbom, Masafumi, Ambassador Masafumi from Japan, and Muhammad Azad from Iran. So I give the floor to Ambassador of China.
Ambassador Xiao?
Yes. Can you hear me, Madam Minister?
Yeah, clearly.
Good afternoon to you. Well, I said my thanks to Dino for the invitation. Thank you, Madam Foreign Minister, for your sharing your views of Indonesian foreign policy addressing the threat of COVID-19. And also good afternoon to everybody, particularly my colleagues from the Diplomatic Corps. Allow me also to say that China supports the Indonesian government under President Joko Widodo in taking measures to contain the coronavirus. And these measures are based on the national characteristic of Indonesia. They are showing good effect. And we wish and believe that Indonesia will win over the battle as soon as possible. Madam Minister, I would like to very much appreciate many points you made, particularly that virus respects no border and no country alone can win the war. We need to synchronize synergizing our efforts to win the battle. And we need a global solidarity. That is the key to win over the battle. Madam Minister, you mentioned about the role of the many organizations, international organizations, regional organizations after the pandemic. My question to you, Madam Minister, is, if you allow me, how do you look at the role of international organizations, especially UN bodies like WHO, since the start of the pandemic? Thank you.
Okay. The next question is Ambassador Changbom from South Korea.
Can you hear me?
Yes, yes.
All right. Thank you so much. I would like to echo what my colleague Chinese Ambassador, Mr. Xiao, has mentioned. That's to thank both FPCI and Madam Minister to join us and also to organize this wonderful public webinar. Korea and Indonesia are showcasing quite a remarkable level of solidarity and close cooperation in combating COVID-19 under the spirit of so-called special strategic partnership. We are quite proud to see that both countries' industries are coordinating each other to supply and produce personal protective gears and equipments and other necessary medical supplies. And especially, I do appreciate Ibu Retno's leadership and very close cooperation, especially with Minister Kang Kyung-hwa, my foreign minister, in leading ministerial coordination group on COVID-19, which is to strengthen global cooperation at the ministerial level. My question is that still in the midst of this global pandemic, a rising trend of economic nationalism and isolationism that you have mentioned is threatening to undermine the foundation of multilateralism and global collaboration. I would like to hear from Madam Minister, what is really lacking in our joint endeavors and what we should do together in promoting and fostering the spirit of multilateralism, especially in maintenance of necessary interconnectedness, such as allowing and ensuring essential business travels and also ensuring the sustainable supply of essential medical items. Thank you.
Thank you. Now, Ambassador Masafumi from Japan.
Thank you. Can you hear me?
Yes.
Thank you, Dino, for doing this. And I also like to express our support and appreciation to all the initiatives carried out by Jokowi administration, leading by Ibu Retno. My question is from a little bit different perspective. That is, how will Indonesia use its leadership to strengthen solidarity and centrality of ASEAN in tackling not only COVID-19 situation, but also other ongoing challenges in the region? Quick background is, of course, COVID-19 is a global challenge that requires regional approach, as Ibu Retno mentioned. So the role and solidarity of ASEAN is more crucial than ever. With this in mind, Japan is happy to support ASEAN's initiatives, such as establishing its own Center for Infectious Diseases. But there are challenges. As Ibu Retno mentioned, situation is different from country to country, and every country tends to isolate itself from others to prevent spread of virus. That makes united approach difficult. And we are also overcome by the unprecedented magnitude of situation created by the virus, but there are obviously other ongoing challenges in the region, such as North Korea, South China Sea, including the negotiation of code of conduct and so on and so forth, which need continuous attention. So this means, I think, the leadership of such countries as Indonesia, which is also a member of the United Nations Security Council at present, is required more than ever. That's the background of my question. Thank you very much.
Thank you. And finally, in this round, Ambassador Azad from Iran.
Good afternoon, Madam Minister, and good afternoon to our colleagues in virtual meeting. I should say Happy Ramadan to Excellency Madam Minister. Yeah. With the permission with Madam Minister, may I summarize the remarks by Madam Minister that I should say that we are all together will be great again. This is the conclusion out of the remarks by Madam Minister. My question is that during this pandemic COVID-19 and regarding the message of Secretary General of the United Nations to stop any war in the world, is it correct to impose unilateral sanctions and maximum pressure on countries with different pretexts and not pay attention to multilateralism and cooperation for peace, security, and prosperity? Thank you.
The floor is yours, Minister. Minister Retno.
Thank you very much, Dino. Thank you very much, ambassadors, for the question posed to me. I tried to respond by one by one based on the issue. One is, again, I would like to underline on the importance of some principle of cooperation, synergy, multilateralism, and Indonesia will always be on the forefront to support multilateralism. Because why Indonesia see that multilateralism is very important for all of us? Because it's everything is based on the bilateral, for example, then that will be very difficult for the poorest countries to deal with the big countries. But by having multilateralism means that everybody get the same protection from the system itself, though we know that in practical, in its implementation, these ideals is also not exactly like what we want to have, but at least there is a system that can protect every country, regardless they are poor, they are rich, they are powerful, they are less powerful, they are all protected with this system. And if you ask, we are all diplomats, especially for the diplomats, we know exactly about the UN system. It's surprising us also that after its establishment for 25 years, the UN and 75 years, and then the UN and its agency and bodies are not able, they are not able enough to respond the pandemic, because this is very unprecedented. So this pandemic will bring us as a wake-up call as well to look at the structure that we have built 75 years and try to make it better and stronger. So not to weaken them, but to make them stronger and can serve better to all of us, not only serve to a number of countries or certain member of countries. So by mentioning that, it goes without saying that it applies also to the WHO. Of course, if you ask me whether the work of WHO is perfect, we all know that it is not yet perfect as other institutions, not only the WHO. But we have to strengthen our cooperation to make the WHO better, stronger. So we have the task to synergize our effort to make WHO stronger and serve better in the future. And then on the cooperation, at the beginning of the cases in Indonesia in March, I was among the cabinet members who tried to think very hardly how to create the innovative cooperation with other countries. And then it came the situation that Indonesia has with, for example, with South Korea, with ROK, and with Japan. South Korea has the raw material for the PPEs. South Korea is also investing in the companies here, foreign companies in Indonesia, while here we have the technology, we have the human resources. So the conversation at that time is, why didn't we combine this capacity together? And then we ended up with the innovative cooperation that we never think before, right, Ambassador of ROK, Ambassador Kim? We never think about this kind of cooperation. Both countries are able to produce more PPEs to serve the needs of ROK as well as Indonesia. And of course, when the capacity is maximum, we could also share with other countries. And the same mechanism, we take it for our cooperation with Japan. You know, Ambassador Marsudi Easy, he texts me even in the middle of the night. Maybe he forgot to check the clock, the watch, what time is it? He texts me at 11:40, almost midnight, to discuss about the cooperation. I don't know whether my ambassador could do the same there. But here, every ambassador, they feel free to text me at any time they need. No problem, ambassador. No problem. Because we discuss about cooperation. That is what I like the most. So regardless the time, the constraint, don't worry. As long as we talk about the good things, then I'm more than ready to discuss it. So finally, with Japan, we are able also to find solution. We created an innovative cooperation, and we produced more surgical gown to fulfill the needs of Japan as well as Indonesia. And we would like to create the similar cooperation with other countries. So that's why in the International Coordinating Group, that is the group of foreign ministers, more than 20 foreign ministers together and hosted by Canadian foreign minister, Indonesia proposed a pooling of capacity. And then we try to connect it with capacity from other countries. And then how this capacity can interconnect each other to produce more that the words are needed right now. So next week, again, we will have the meeting and Indonesia will table the proposal. So hopefully that based on that proposal, then we will have many more innovative cooperation again to fight against this virus. And then on the ASEAN issues, to be very honest, I think I can say that we are it's very beneficial for us to have ASEAN. It's good to have ASEAN. Since the very beginning, since early January, ASEAN had consolidated themselves, their position to respond to COVID-19. I remember very much my meeting in Laos in February. I think that was in February. On top of the ASEAN meeting, we have the special meeting with the Foreign Minister of China as well. But the Health Minister of ASEAN started their work in January. And Indonesia were among those who proposed to have the ASEAN Summit virtual meeting and the ASEAN +3 Summit virtual meeting. And thanks God that it happened. And the discussion is not only repeating the political statement, but the leaders, the ASEAN leaders, the ASEAN +3 leaders were able to talk, to discuss about the concrete cooperation. For example, we are talking about reallocating some fund in the ASEAN to be the ASEAN Response Fund for COVID-19. And I think basically the +3 countries supported the proposal of ASEAN. And then of course we have already the mechanism, many mechanisms within the ASEAN +3 that we agreed to strengthen this mechanism or to make the mechanism better. And then the Japanese ambassador mentioned about the idea of establishing the regional CDC in Southeast Asia. So many concrete cooperation were discussed among ASEAN members and ASEAN +3 members. So I do believe, colleague, that regionalism will be very important in the future of our life. And this is a building block to make globalization works better in the future. And I would like to underline again, Ambassador Iran, that as you mentioned, synergy, cooperation are badly needed in this difficult situation. Because by only having that, then we will be able to fight together COVID-19. And I don't think that you will believe, if you are able as a country to defeat COVID-19, while you let other countries to see and to encounter the spike of COVID-19, then your country will be free of COVID-19. No, we have to fight it together and we have to win the battle together. Thank you.
Okay, thank you. Let me take quickly the second batch, and I hope you will ask your questions very quickly. I will take
yes. Sorry, Dino. I think I have to leave now because it's 5 to 4 and I have to jump to another meeting, the cabinet meeting. But maybe one question is okay?
One question from the student I will take, yes. Okay, I'll take one student from, why don't I take it from your alma mater, from Gajah Mada, okay?
Please.
Gajah Mada. Gajah Mada? Okay, Gajah Mada, you're on.
All right. Thank you, Your Highness.
Quick question, please. Yes.
All right. How's Indonesian effort especially regarding in particular human rights issue as a member of UN Human Rights Council? We're facing a potential human rights crisis as seen from discrimination in access to service, inequality that impedes access to health, stigmatizations, and social economic impacts. That's the question.
Well, thank you very much. So you're from FPCI, is it? From
yes,
international
from
relations?
international relations.
All right. Okay. So exactly that was my alma mater. All right. Okay. So when we talk about human rights, sometimes we forgot that human right is so wide. And we forgot sometimes about right to development, right to health, right to education. And you mentioned clearly about the right of health, of having the access of health. So health for all is very important. So that's why since the very beginning, this pandemic emerged, Indonesia is very consistent in voicing out the importance of having the equal access for the developing countries, for least developed countries, for all countries to vaccine and medicine. And somehow we know that we have the regulation, the international regulation, for example, the TRIPS regulation. But at the same time, please look at the TRIPS regulation. There are at least there are a number of flexibilities that provided by the TRIPS regulation. So why don't we use this flexibility for humanity? So this is a call especially for developed countries and for big pharmaceutical company. Of course, again, the patent is very important. We respect the way you work to find the patent, but at the same time, please see also from the perspective of humanity. Because if we fail to see from the perspective of humanity, then we are going nowhere. And for sure, the SDGs, the Sustainable Development Goals, 2030, which is only 10 years away from now, that won't be fulfilled. So the attainment of SDGs will be jeopardized if we are not ready to share with others. So this is part of implementing what we call human rights. Thank you very much.
Thank you very much. I think on behalf of everybody here, the ambassadors, the diplomatic corps, the students, and the think tanks, thank you very much, Ibu Retno. I know you have tons on your plate, but we really appreciate you coming here and sharing your thoughts with us. We want to wish you all the best, and please be safe. Stay away from COVID-19. Protect yourself, and we need you to lead Indonesia. And be active internationally to help beat this common enemy of ours. Let's give a big hand to.
Thank you, my brother. Thank you very much.
Thank you.
Okay, bye bye.
Bye bye. Udah off semua. Maksudnya tapi udah off. Udah. Well, I think I don't have any final word, but apologies to I have several questions from ambassadors and students and think tanks, but we had only 15 minutes, and obviously we couldn't accommodate all the questions. Thank you very much, and please tune in to future FPCI events. We intend to be even more active in the time of COVID. We want to be the premier virtual public forum in Indonesia on foreign policy issues. And if any of the embassies taking part here want to work with FPCI on any issues that you're working on, by all means, please contact us. But thank you very much, and please stay safe and healthy. And for all those who are tuning in today, thank you for listening, and do spread the link of this discussion to all your friends in campus, in the family, and around the neighborhood. Thank you very much. Bye-bye. Sudah off, Pak? Sudah. Tapi kita masih di sini kan?